And that it is indeed time for our discussion. So if our speakers could go ahead and put themselves back on camera. We have heard a lot of broad statements made. I'd also like to introduce another member of our panel, Dr. Carrie Gross from Yale, who is going to provide some expertise and is joining us in the discussion. And we have a lot to consider. Let's start by asking Dr. Gross if you'd like to make some comments on your overview of the discussions that you've heard and what your perspective is.
Yeah, thank you. Thank you for inviting me and allowing me to both watch the presentations and make a couple of comments. I was just reflecting while watching this that one of my first research endeavors as a new faculty member about 20 years ago was to conduct an umbrella review looking at the association between financial ties and research outcomes. And we found that the odds of an industry-funded trial yielding a positive or pro-industry outcome was more than 3 times the odds that of a non-industry trial. And over the course of the next 20 years, this relationship has only become more pronounced, more well-known, and the impact, I think, is insidious and prevalent. And I was really struck by Laura Schmidt's data with regard to federal nutrition research. The investment is about $1.5 billion from the federal government compared to $60 billion from the food and beverage industry. And I'm a cancer researcher, and over these past 20 years that I've been thinking about this area and working in cancer research, I've noticed that, for instance, the number of published clinical trials that are sponsored by industry has increased from about 50% of trials in high-profile medical journals to now almost 90% of published randomized trials in the cancer space are sponsored by industry. So I think we've reached the point where industry sponsorship of clinical research has become the norm, and we're overly reliant on it. And it's causing us not only to have a bias in the research that's being done, but our whole research ecosystem is so dominated by industry sponsorship that it also affects the choice of research. It affects the research that's not being done, looking at, for instance, comparing 2 drugs within the same class, or 2 treatment regimens that may be commonly used, and we're not sure which one is better. We're also not funding research looking at, in the cancer world, looking at prevention, or looking at how to identify value-based or equitable or high-quality care with nearly as much of an investment as we should, because we're I think largely because of the industry predominance, and also largely because we have a mindset that is really focused on finding a cure, finding a treatment, and that also biases the type of research that we're doing. So I really think it's important to think through how can we reassess the research ecosystem, which is something several of our speakers have brought up, and think, well, gosh, if we were going to design this from scratch, we never would have designed where we are right now. So how can we think about bold changes to reconfigure our ecosystem so it's meeting the needs of patients and of society?
So there is, this notion. It is incredibly expensive to do clinical research. And part of the reason is that, industry is willing to invest, and we haven't funded the federal government to be able to be a counterbalance. And in fact, we sort of count on the FDA to act as an ex post facto sorter of what was too biased to use as evidence. And that's probably not enough. I'll also note, just to the question that was raised about, is intellectual conflict of interest sufficient to justify? I actually just look at the scientific method. The basis of the scientific method is that you needed to blind the investigator in order for the experiment to be done in a way that could be truly believed, because there was an assumption that the scientist doing the work might be biased in how they interpreted the results, which is why we have blinding, which is why we have placebos. So there can be no doubt that intellectual conflict of interest can be real, can be meaningful. And the question is, how do we interpret that kind of conflict of interest relative to the weight that comes from having somebody design a study with a purpose, which is what happens with much of the sponsored research that is the subject of this conference. Since Dr. Barrow is here and has raised her hand, we'll give her a chance to ask a question or comment.
Great, thank you so much. And actually, it's a direct follow-on. And I just want to say I really appreciated the panel today because it's piling up the evidence on this question about influence on research. But I do want to clarify what I think's gotten a little muddled in the discussion. There's a lot of influences on research. I think we'd all be naive to think that, research isn't influenced. It's value-free, right? But what we're really interested in is bias. And as I said in my definition yesterday, a bias is a systematic deviation in results and potentially inferences. And the talks today clearly illustrated these biases related to industry funding. And a lot of the other potential influences that were mentioned may not be a bias because they don't demonstrate a systematic deviation. And by that, I will include things like the intellectual so-called conflicts of interest that Dean illustrated so well, personal experience, implicit bias, social, psychological factors. I mean, there's a lot of things that influence research, but what we're really interested in studying is bias. And that's why my question is for Adam, because I think everybody is fascinated by this idea of developing a more automated tool to do this painstaking work to identify bias and assess risk of bias in an individual study. And based on the evidence we have, would you put, for example, funding source and investigator conflicts of interest into that tool to assess risk of bias? Because there's been some resistance to that, I know, and also kind of what are the rules that you would use to select these factors for your tool?
Thanks, Lisa. Look, yes. So we understand and we know that financial conflicts of interest are associated with systematic biases, and that they absolutely should be put into a model. Other factors that are related to personal research agendas would not be included in a new model of risk of bias. Probably what I would do if I was using machine learning to do this is that I would capture as much information that I could connect to the document that we're looking at. And so that might include, for example, the registration, the protocol, the text of nearby studies that are on similar topics. And then I would use lots and lots of examples from the past where bias has been annotated to build that into the outcomes and then to train the model. So the short answer to the question is absolutely what you said is correct. And yes, I would absolutely include financial conflicts of interest and funding in a model. And I wouldn't attempt to include anything related to, for example, intellectual conflicts of interest or whatever they're called, non-financial conflicts of interest.
Thank you.
So, I have to, in machine learning, the risk of the model being based on data which is intrinsically biased is enormous. And that's been an issue, for example, in some of the, trying to define clinical outcomes of looking at, for example, populations that didn't have access to services and therefore had worse outcomes and therefore were predicted to have worse outcomes in the future, but it was on the basis of them not having access to services. So it's really important because it appears to be hidden, just like much of what we've seen today. Those biases are hidden. In machine learning, it's particularly easy for the biases to be baked in and not easy to pick up.
Yes, absolutely. The main thing about modern machine learning is that we do absolutely address things related to things like fairness and equity, interpretability and explainability. and other aspects related to generalizability and transportability. And what you were talking about relates to the first two of those. One, that the machine learning model can explain the decision that it made, and it can tell you what factors it used to decide. And also fairness and equity relates to this kind of minority problem, that if you feed in data where most of it comes from one space, then it might do a really bad job of predicting for a minority. And that's the issue with fairness and equity in machine learning. In this case, the way that you would train it, you can actually train these models so that they are fair and equitable. And that just comes down to the technical way that you introduce the sampling of the annotations. It kind of relates also to the important component that I mentioned at the end of my talk, which was that we need to share computable data and annotations much better. I would love to have a database that had thousands of examples of individual studies that were annotated for bias retrospectively, because I could take those and then apply them to new studies that I hadn't seen before.
Yeah, it's an interesting, the trick is the sort of hidden stuff. So we know Dr. Michaels has to leave soon, so you have a comment.
Yes, I have to get off because the National Toxicology Program's Board of Scientific Counselors is about to have a meeting and I'm needed for the quorum. So I apologize, but my comment is around this disclosure of conflicts that we accept as a given, that it's sort of necessary but not sufficient. There are lots of limits to it, but we don't question whether there should be disclosure. There's one very important area in which disclosure is not required, which is in federal regulation. When under the Administrative Procedures Act, all federal agencies are required to ask for public comment on any new regulation, the public health regulation, environmental regulation. And we expect to hear from stakeholders, but there's no requirement that the stakeholder who puts in a comment provide any sort of information about who funded the comment or who funded the study or the data that they're putting in. Sometime in the, probably 15 years ago, Wendy Wagner, who's at University of Texas, and I had a editorial in Science magazine calling for that. And then when I became head of OSHA, I actually implemented that, where in our proposed standard to protect workers from silica and then from beryllium, we asked commenters to put in, to essentially make the same disclosure they would have to make for the Annals of Internal Medicine or the JAMA or Science. It was incredibly controversial. I received a letter signed by 13 Republican senators saying that will discourage people from sending in comments if they have to say who paid for it. I was called down to discuss it with the Republican staff. Fortunately, there was a very strong editorial in Nature supporting the proposal, and we were able to do that. Of course, with the Trump administration, that idea stopped, but I would like to see that introduced in all regulatory systems. We should know, who paid for these comments. So thank you all. This was a great discussion.
I will note as an organization that often comments on responses to federal legislation, we are often, when they're counting numbers, there are all those people who are sitting in the postcards, and those numbers count, just like our 6-page documents.
No, so, I have to tell you, as a regulator, we would get hundreds of postcards, and they're really discounted. I mean, you tell people the most important thing is to have substance in the comment, and one strong, well-based comment is much more important than 10,000 postcards saying we don't like this. So anyway, thank you so much.
We like to think so. Dr. Mickey.
Yeah, it's an analogous situation, but we've been using a tool called quantitative textual analysis to look at responses to consultations. And we were able to show, for example, that the submissions we were able to differentiate industry and public health submissions on the European Union Tobacco Products Directive, but also to show that the actual document that was being consulted on did actually shift over time towards the tobacco industry position a little bit. We also showed that WHO sugar guidelines did not. And we've got another paper, which is, I think, just about to be accepted, looking at looking at acrylamide, which is a substance in foodstuffs, and showing that the industry responses were on a spectrum. So depending on whether they were proposing a solution or whether they were producing the acrylamide. So I think that there are techniques available that do help you to sort of get behind. And then when you see an aberrant result, a submission that looks like it's from a legitimate or an unbiased organization that it doesn't appear to be on the spectrum, you can then start asking questions.
And I also will note you put a note that you published a explainer on AI, so people can look at that and get a chance, including the bias issues.
Probably very simplistic, but it may be helpful.
Okay. Rita Redberg.
Thanks. I wanted to, I think maybe David Michaels left, but just second his comments on the importance of federal agencies and the disclosures of conflicts of interest. And also, I mean, as past chair of the Medicare Coverage Committee, and I think, and having worked in the Senate, as everyone here knows, I think a lot of patient advocacy groups are industry funded, and frequently these representatives from industry funded patient advocacy groups would either submit comments and or come to the MedCAC meetings. Really the only people that come, the only patients that come to the MedCAC meetings, because it's not really desirable to go to the CMS headquarters in Baltimore and spend your day unless you have a particular and often financial interest in it. But yet routinely they were not disclosed, even when, as chairperson, I would say, if you're representing an organization that gets funding from a company. I'm thinking now the lung cancer screening, and I knew that the organization was funded by Siemens, which made the CT screening, and yet the woman said, no, I have no conflict of interest. So I do think that those are important, particularly financial conflicts. And I just will add also, I think Lisa Vero showed us very convincingly yesterday that actually the raising the issue of non-financial conflicts is often a sign that there is industry sponsorship. And I think it's often done to deflect from the financial conflicts. And I think we all have opinions and thoughts, but those are very different than conflicts of interest. And I think the distinction Lisa made earlier of does it lead to a systematic bias is very important.
Okay. Well, there are a couple of questions that are being raised on the web, so I'm going to ask one of them and throw it out to all of you, and you can leap to respond. The first one, can someone discuss allegiance bias among researchers? In my area of nutrition research, I can correctly presuppose the direction of an outcome from the title of the paper and the name of the senior author, whether the study is about health risks of carbohydrates, fats, red meat, or others. Sounds like an editorial, but if anybody would like to comment.
Yeah, I'm happy to actually, because I think that we've seen an awful lot of this during the pandemic. It's different from what we're talking about at the minute, but I think the interpretation of evidence around COVID and its transmission, there are many cases there of where people have, I mean, I'm thinking of particularly the role of children in the spread of COVID, where we have seen one systematic review, which was very much inconsistent with the literature it was reviewing, to be perfectly honest. And the feeling that those who were writing it had a particular view which came out very strongly, basically saying that there was very little risk. So I think in that area in the pandemic, that if one thought about it for a minute or two, one could think of many examples where people have come at it because of their views about how serious the virus is and how it's spread and so on, which has shaped the way in which they've interpreted the evidence.
One's allegiance to a political party might be correlated pretty well with your allegiance to ivermectin as a treatment, for example.
Well, it is actually, we know that. And we've got lots of evidence on that because, again, thank you to all of you in the United States for being such a rich natural laboratory in that you've got two parties and people do report their membership or their affiliation. And it comes out in terms of trust, it comes out in terms of attitude, and even some of the very interesting work looking at how Google searches in counties that were Republican or Democrat for things like hand sanitizers differed, but then changed when President Trump changed his view. So there's you could have an entire seminar on that, in fact.
But yeah, so the answer is allegiance bias does play a role. Anybody else want to comment on that?
Yeah, I did want to comment. I mean, I think the question is a reasonable one, and it gets back to Lisa Barrow's distinction between conflicts of interest and bias. I think we should review every paper with a concern that there may be bias, and certainly if we are aware of a pattern, we should be particularly sensitized and reviewing for opportunities where bias may have been introduced. But even in that example, where I think really it's about one's identity being wrapped up in the relationship between the investigator and the truth, and by way of the truth, I'm talking about the public, the relationship between the investigator and the public is very different than the relationship between an investigator and the public that is mediated or moderated by a third party whose interests go beyond truth to the public. And this notion of a third party being involved, whose interests may supersede that of the public's interest or pursuit of the truth, is the critical difference between one's allegiance to one's identity and identity politics and how that affects your relationship to the public versus one's relationship to that third party and that third party's mission. So I think there hasn't been enough discussion about the third party in the context of this particular non-financial conflict of interest discussion.
So some of it, there actually is this intermediary. Ilse was an example. Another example was the foundation that funded, I think it was like Foundation for Good Lung Health. It was a tobacco-funded foundation that funded early CT screening studies for lung cancer and found that, yes, it helped. But it was being sponsored by a tobacco company, but through an intermediary that made it look like there was not tobacco money supporting it. The essential problem is the same. It's sponsorship. The issue there is the masking of the sponsorship.
The problem is not just the sponsorship, it's the sponsor having a third party interest in the outcome.
Mm-hmm. Having a third party acting in their interest.
Correct.
To affect the outcome. Okay. Lisa. You're muted.
Sorry, I just want to have a brief response to that last question, because this is really a value where meta research comes in, right? So say you think you can predict the results of a study from an investigator's lab. And it's true that some investigators study the same hypothesis for their entire career, and they may disprove or prove that hypothesis in various papers. And that's because they're an expert. And as we know, experts have been roundly attacked during the COVID pandemic, because it's thought, oh, you do research on a particular molecule, so you must be biased. And so we have to really be careful when we're talking about what we think is somebody's research track record and whether that's a bias. But of course, that's the beauty of meta research, because we look across a whole body of evidence on a particular topic, not just the research from one particular laboratory. And that's when we can detect bias as the systematic deviation in the results when we look across the whole body. And so that's how we've detected industry bias. And that's how we could see, for example, if one particular laboratory is an outlier. But when you look at the whole body of evidence, they might not be.
Yeah, it can be really hard. And part of this pattern is by looking at the pattern, you're trying to see through what wasn't included, like in a paper, what was not included. If somebody changed the primary endpoint between the time the protocol was written and the time the published paper came out, you might not ever know. If you're a reviewer, you probably won't know. The editor won't know. And there are some journals which require the original protocol to be included as part of the submission. But strategies like that, you could have it look like it's good science, and yet it's actually not.
But that's why looking across the body of evidence is so important. And I totally agree with Adam and Martin. reviews can be biased as well. And, but if reviews are well done, that's a way to detect these issues. Sorry, I'll let Laura go ahead.
Okay, yes, Laura.
Yeah, I want to return to Dr. Gross's really thoughtful introduction. And he pointed us to the ecosystem of science and the sort of entrenched way in the funding of cancer research. NCI is the biggest institute at NIH, and yet it's a problem in cancer research. That just with 90% of studies. And I think something that hasn't come up around this ecosystem is the gradual, or maybe not so gradual, way that the public consumes information. And a lot of, even reporters are getting a lot of what they have to say off of social media. And people feel a direct connection to a scientist on social media, and you can ask a question, and I think it really increases the urgency for us to be managing conflicts of interest and making that information public, because anybody can, and I think the COVID crisis, as Dr. McKee pointed out, really demonstrated the problem here. And all you have to do is run in your mind the counterfactual. What if the pandemic had unfolded without social media and all of the science had to be transmitted in some other way? And so this makes me return to Dr. Dunn's suggestion that we try to figure out a way to automate this and make this information public, and give somebody a very transparent way to score things so that people can consume scientific information in a context.
If you want an example, actually, there is a way to look at what the impact would have been without social media. Look back at a city like St. Louis or Philadelphia, where there was very good documentation about the flu epidemic in 1918. And how people responded. And it's surprisingly analogous to how people acted when aided by social media. Adam.
Yeah, look, I spend most of my time studying social media and misinformation rather than financial conflict of interest. So it's an area I know pretty well. But I really wanted to come back to and follow on from what you just mentioned, Laura, around this idea of a scoring system or something that we're going to do, because yes, we can have perfect disclosures of conflicts of interest and of funding. But the question is, what do we do when we encounter it? Should we just throw it out and move on? Or is there a way that we can account for biases that we predict or estimate or identify in the studies that we produce so that we can still make sense or make use of the research that's presented? And not waste it all?
Yeah, it is. It's a real challenge because it's a lot of work.
Can I ask Adam a question about that? Which is, let's go back to my story. If you looked at that ILSI-funded systematic review of added sugar guidelines, without a sophisticated AI machine, we use what we call the sniff test. I don't know if you have that in Australia, but it's the sniff test. And the sniff test is pretty darn accurate. At least it's sensitive, let's put it that way. Or maybe it's only specific, but the problem was not in the sniffing. The problem was in, okay, what do you do when there's a conflict of interest as an editor? And you may even suspect that conflict of interest may be influencing everything from the research question to the findings to the dissemination. What do you do if you get an AI-generated score that suggests that there might be some bias here in terms of publication? What are you suggesting the machine would lead to in terms of decision making as it relates to the most important step, which is the dissemination to the scientific community and the public community? How would that work?
So my vision would be that we attack it from both ends. The first one is that we need to be much more transparent about the data and the information that sits underneath, and the measure of how we design things as well. And so that's why things like, registrations and protocols and structured reporting of results is so important. Because then we can start to deal with some of the issues that are the mechanisms of introducing bias into the research. I think that at the other end, if we can say that we're able to estimate the risk of bias in an individual report, or even in an individual media communication, that we could flag that. And so we could either flag that so that a reader who was just trying to interpret the evidence would see that flag immediately and say, well, maybe I should be a little bit careful about how I read this one. Or second, that we quantitatively adjust for what we know about that study. So if we believe that this study is at high risk of bias, maybe we downweight it. Maybe we reconsider what the confidence interval should look like. I don't have the statistical skills to be able to figure out how we're going to do that, but there must be some way in synthesis that we can say, we expect across this body of evidence that we're going to see more positive results than the truth. And so we need to adjust that. For example, in a guideline, you might downgrade the level of evidence or something like that. I don't have the solutions there. I'm hoping once we get to the first step, which is to say, we estimate the risk of bias in this individual document, that then a whole bunch of smart people will come in and tell me how to do the statistics at the other end.
I'm going to ask for Dr. Gross to comment, but on the way to that, I'll note that there is data that unexpected findings are more likely to be published, and unexpected findings are more likely to be ultimately retracted. So, using AI to find a pattern may help you predict sort of where you're going. But Dr. Gross?
Yeah, thanks. Just building on this idea of identifying bias and somehow transparently relaying those concerns or the evidence of bias to the public, I'm just curious what other panel members think about what we can do as scientists and policymakers to better engage the media. Because I've noticed over the years, there has been a little more nuance in the way media have described some studies. Maybe they'll mention this is only available in a press release, hasn't been published yet. So I think there's been some progress, but I feel like there's, at the same time, social media has allowed direct conversations, if you will, between the scientists and the broader public. There's still a really important role for the media here for packaging and reporting and spinning, if you will, scientific studies. So I'm curious how we can engage the media in better understanding, reporting, and potentially mitigating the impact of financial conflicts.
Laura, you leapt up.
Yeah, I think there's a structural issue here, which is that reporters are trained to show both sides and to sit in the middle. And when the whole evidence base is flawed and biased, they wind up feeling compelled to report on, and the most, in my experience, the really good reporters, the New York Times or the really AP, you can tell them, oh, okay, the reason you're hearing all of this conflicting scientific opinion is because that person is, very well known. The person you talk to is very well known to work for the industry, and you should consider that. The best you can hope for is that when they show both sides, they'll say who that person is. Again, I think it goes back to the idea of a scoring system. So that, but I do think that there's a real problem in the professional strategy of reporters, what they're trained to do, and how do you manage it when the whole evidence base is biased.
Lisa?
Thank you. I totally agree with Laura's point there. And I also think we need to ask consumers of the information what they're looking for. And in Cochrane, we had a big debate for a while that the consumer groups in Cochrane wanted in the abstracts of Cochrane systematic reviews to list how many studies included in the review, if it was for a drug, were industry funded or not. And that's because they realized that there were some Cochrane reviews where the entire evidence base was industry funded because all the studies were industry funded, and they wanted to know that. We actually report that in the Cochrane review, but it's not still in the abstract, but that's something when we do media on a Cochrane review, we might mention. So I think, it's important to know what people want to hear. And I think Laura made a great point. You need to know who you're talking to, right? That's what you want to know, who you're talking to. And I don't know if you all know, but Jeannie Lenzer runs a list actually of researchers who don't have financial conflicts of interest. She's a journalist, and it's quite a long list. You have to apply to get on it, but that's the kind of list I think, Laura, you were talking about, where journalists would have a quick and easy place to go to find people who have no financial conflicts of interest.
Dean?
Yeah, I want to expand on what Laura was talking about in response to Carrie's question about the media. I mean, I think what I've tried to convey to media contacts when they're interviewing me is that actually, if you're doing a story on the science, you actually have to be more of an investigative journalist than anything else. I'll give an example. I was a co-chair of a federal diabetes commission that made recommendations around federal policy related to the diabetes epidemic. And the New York Times decided to do a story on the commission's report and findings and recommendations. And a couple of days before this journalist, Ronnie Rabin, who's an outstanding journalist in the New York Times, she called me and said, "Oh, the article's going to come out in a couple of days, and just so you know, I interviewed the American Beverage Association, and they showed me this incredible figure that showed that as soda consumption went up, as soda consumption went down, rates of diabetes were still going up." And you remember I showed you that slide in the beginning of how there's a 15-year lag. And so I showed Ronnie Rabin, well, let's look at the 40 years here, and we can show how as soda consumption went down, 15 years later, diabetes incidence rates plummeted. And so that kind of degree of journalism requires an investigative journalist approach. You have to say, okay, I'm hearing this statement coming from industry. I wonder, if I'm an investigative journalist, what might be behind it. It's a fairly intensive amount of work that would need to go in to transforming the media market to one of reporting discoveries or controversies versus uncovering truth.
Would anybody like to make one last closing comment? I think we're getting close enough to the hour that we're going to call it a session, but I really appreciate everybody's thoughts, opinions. It's been a very invigorating discussion. And I hope we will all see you tomorrow as we have our closing session on strategies to deal with conflicts that come out of an interpretation of data that comes out of sponsored research. So with that, I think we will call it a day. And thank you very much.